The Health and Social Care Committee is currently holding an inquiry into new psychoactive substances, also known as legal highs, in Wales. Here's how the inquiry has been conducted so far.
Today in many of our communities there are substances that people call legal highs. But this term is misleading because it suggests that they are safe. We don't understand enough about these terms and these issues yet, and we need to find out more. We're asking organisations such as the Welsh Government, the police and the health services what they know about these substances and what education is being provided to the communities on them.
The committee launched the inquiry in July 2014. The committee also created a survey which gathered the views of over 1,000 respondents. In September 2014, the committee split into two groups to visit service users and providers in Wrexham and Merthyr Tydfil. Here's some of what the participants told us.
Today I went to voluntary action in Merthyr Tydfil to discuss a governmental approach to tackling the problem of new psychoactive substances, often called legal highs. We discussed the impact that new psychoactive substances have in our individual areas, the impact that it has on services, and the ability of services to cope with the influx of new drug users.
I think the main points that were really raised was around how we can try and legislate against the drugs, but actually that not being the only answer, and us needing to adopt a multifaceted approach, primarily looking at prevention and education around novel psychoactive substances, and obviously then support elements to that for people who are using them and finding them to be problematic.
The committee received a total of 18 written submissions as part of the inquiry, which were used to inform the oral evidence sessions.
Actual statistics are really quite hard to come by because we don't really know what our baselines are for trying to determine this, not least because quite a lot of the substances out there are still legal, so they don't necessarily turn up on crime statistics. It would be sort of foolhardy really to try and put facts and figures around this, other than to say that a number of drug treatment professionals, youth workers and criminal justice workers around the country, including Wales, are expressing concerns about some of these substances and the effects that they have.
I think that NPS, new psychoactive substances, is a growing issue. Certainly we've seen a substantial escalation in use since around 2009-10, particularly in Wales with synthetic cannabinoid use and with stimulant use. So we believe that it does represent a substantial public health harm and a growing harm.
And we feel that the model in Ireland, whilst we haven't been there either to find out how successful it's been, surely, we would think that legislation that would make it necessary for the supplier to show that it's not harmful and legal would be better than what we're currently doing, which is just simply playing catch-up. And it's seriously expensive and resource intensive.
I noticed there's mention of UK legislation. Is this where we should be working with the UK?
We believe so, absolutely.
Or should we be sort of following our own path and trying to bring in?
There's probably an opportunity, and I could be totally off the mark here, for the Welsh Government to be seen to be the leaders.
I was in Swansea Prison just 2 or 3 weeks ago, and officers there were telling me that their colleagues in Cardiff Prison here were reporting an increase in the synthetic cannabinoids. So I think it's on its way.
Well, our evidence shows that. Really.
Yes, it's on its way.
We've been out and about and talking to the people, and they're saying that black mamba and different substances like that are being used commonly in prisons.
Absolutely
so,
right.
I think we accept, and perhaps you do accept, it's on its way.
It's definitely on its way, yes. And all of the necessary strategies need to be put in place before it's too late.
What about the next steps?
As you have seen, there has been a great deal of activity as part of our inquiry so far. We are now beginning to get a clearer picture of the issues relating to new psychoactive substances here in Wales. More importantly, we're also starting to get an idea of some possible solutions. So what happens next for the inquiry? We will use the evidence we've heard so far to help us prepare for our scrutiny session with the Minister for Health and Social Services on the 26th of November. After that, we will consider all of the evidence we have gathered from the survey, focus groups, written evidence and oral evidence, and prepare a report which makes recommendations to the Welsh Government on the areas that we feel require more work. Next, the Welsh Government will respond in writing to the committee's report and recommendations. Our report will then be debated during a plenary meeting of the whole Assembly. For more information about the inquiry, you can follow us on Twitter @SenethHealth or join in the conversation at #NPS and #LegalHighs.
To keep up to date, follow us on Twitter @SenethHealth or check out the links below for updates from the committee's webpage and our Storify.